Next speaker is Dr. Kumar, and he's going to talk about estimation of hematological parameters, including neutrophil-lymphocyte ratio, platelet-lymphocyte ratio, and red cell distribution in childhood community-acquired pneumonia.
Good morning, everyone. Myself, Dr. Ranvijay Kumar, JR pediatric resident, RIMS Ranchi. My topic is estimation of hematological parameters, including neutrophil to lymphocyte ratio, platelet to lymphocyte ratio, and the distribution width in childhood community-acquired pneumonia and its relation with the disease severity. Introduction. Pneumonia defines as inflammation of lung parenchyma is the leading cause of death globally among children younger than 5 years of age. WHO defines pneumonia in children as presence of cough or difficulty in breathing associated with fast breathing or chest indrawing in children of 2 months to 59 months of age. Severe pneumonia is defined as pneumonia with danger signs which include not able to drink, lethargy or unconsciousness, persistent vomiting, convulsion, stridor in a calm children, or in a case of severe malnutrition. As patients with pneumonia usually lacks typical clinical manifestation in early stage, patients are prone to gradual exacerbation of disease due to improper treatment of empirical antibiotic and other reasons that even lead to develop to a certain stage of disease that result in severe pneumonia. And elevated TLC count can be an indicator of bacteremia, but is also present in many viral illness. Few studies show that TLC count less than 4,000 is associated with bad prognosis, including mortality. The NLR and PLR are referred to the degree of inflammation and the stage of immunity and the state of immunity. NLR is an important index that reflects the activation of inflammatory cells. The higher PLR, the higher the degree of platelet activation. We speculate that the abnormal platelet count may be a marker of severity in patients with community-acquired pneumonia. Thrombocytopenia is also a recognized marker of poor outcome in patients with pneumonia due to association with low platelet count with DIC and severe sepsis. Thrombocytosis favors an exaggerated systemic inflammatory response, and RDW is the variation of coefficient of red blood cell volume in circulating red blood cell system. RDW is significantly associated with short-term mortality in patients with community-acquired pneumonia, and higher presenting RDW was associated with increased risk of severe community-acquired pneumonia in hospitalized patients. My aim of the study is to estimate hematological parameters and its relation with disease severity, which has important role in triage, management, and even early referral of patient in remote areas. Material and method. This was a retrospective case control study. Here 2 ml of venous blood sample was taken in ADT vial from the children of pneumonia for CVC along with the control group who fulfill the inclusion criteria from 1st March 2023 to 31st of August 2023. My study population include the pediatric OPD patients, pediatric ward patient, ICU patient, as well as vaccination center of RIMS Ranchi. Inclusion criteria is age group of 2 months to 59 months, patient presented with sign and symptom of pneumonia, and a parent who give consent for sampling and examination. Children of 2 months to 59 months who came for vaccination as considered as a control group after taking consent from their parents. Methodology. CBC was collected at the time of initial assessment of all patients, which include pneumonia, which is of non-severe form and severe form of pneumonia, as well as in a control group that is of vaccination population. Individual parameter like hemoglobin, TLC, platelet count, hematocrit, along with NLR, PLR, and red cell distribution with from CBC was analyzed with the severity of pneumonia, and the quantitative data will be expressed as mean and standard deviation. Result in our study, we have selected total of 80 control group. Those patients who came for those babies came for vaccination after consent, as well as total of 80 cases, which include 40 of pneumonia patient, which is of non-severe form. Actually, these pneumonia patients are mild, but WHO did not use mild term, so I have used non-severe form of pneumonia, and 40 of severe pneumonia in our study group, study period of 6 months. There is various parameters of CVC is compared in case and control group as well as pneumonia and severe pneumonia form. This bar graph depicts the relation of hemoglobin and hematocrit mean value along with the standard deviation in case and control group. Here left hand side is case and right hand side is control, and the hemoglobin mean hemoglobin In a case group is 9.88 with a standard deviation of 1.50, which is less than in a control group of 10.81 with a standard deviation of 0.77. And this light green one is hematocrit, showing hematocrit. Hematocrit level in a case group is 31.96 with a standard deviation of 5.61, which is almost equal to the control group of 32.04 with a standard deviation of 2.17. This bar graph shows case and control group of PLT and standard deviation and mean of TLC in a case group is 11,231, which is more than in control group, that is of 9,242 with a standard deviation of 1,135. Similarly, in platelet case group, platelet is 3,13,000 with a standard deviation of 1,18,000, which is more than in control group, that is of 2,56,000 with a standard deviation of 53,000. Similarly, NLR and PLR mean and standard deviation values in a case group and control group. In a case group is 1.29 plus 1.29 with a standard deviation of 0.83, which is more than in control group of 1.26. Similarly, in PLR, case group is 70.44, which is almost equal to the control group of 68 with a standard deviation of 15. In RDW, mean and standard deviation is 18.5, which is more than control group of 14.11. Similarly, I have summarized severe pneumonia and non-severe pneumonia on behalf of severity. Hemoglobin of severe pneumonia is lesser than in case of non-severe pneumonia, as well as in hematocrit it is also lesser in severe form as compared to non-severe. Here TLC count in severe pneumonia is more than in of non-severe pneumonia. In fact, in platelet also we have seen that it is almost equal with a wider standard deviation range in case of severe pneumonia. Here similarly, NLR and PLR, RDW, discussion of my studies. In all FIV studies, there is less hemoglobin level in case as compared to control, and even also in even more lesser in compare is in severe form. Similarly, in hematocrit, in both of the studies, including my study, it suggests that hematocrit level is almost equal in both case and control. TLC count in all above study, TLC of case is more than control. Platelet count, platelet is almost equal and with a normal range in both case and control. Similarly, in NLR, it says that NLR in case is higher than in of control. PLR ratio in above studies, PLR in case and control group is almost equal, except in Handoya et al. Study, which is probably using median stats for comparison. In our study, mean value is almost equal with significant standard deviation of.
Could you just go to your conclusion? Sorry.
Okay, sir. Conclusion of my studies, along with clinical examination, a simple lab investigation CBC, which provide a lot of information regarding severity of disease, that is helpful in management and even referral of severe cases. Here NLR, PLR, RDW is considered a significant parameter for severity assessment, and platelet count may be normal in severe pneumonia cases, thus considered a less sensitive marker. These are my references. Thank you.
Thank you. Could I just ask, on the different parameters you looked at, did you do any statistical analyses on the actual differences? I know that did you do any statistics on the different parameters that you presented?
I'm using mean value and standard deviation.
I just wondered if you did a statistical to see if they were statistically significant, the differences between the various parameters you presented, or were they just higher and lower without any stats?
Just a comment, reading through the numbers, many of them didn't look statistically significant. That was just my eyeballing of those numbers on the tables there. But it might be worth doing the proper analysis so that you know which of those tests is worth doing. Yes, please.
I am old enough, probably forgotten. Any viral, usually Epstein-Barr virus causes a high leukocyte count. What viral pneumonia, this induces this high TLC count. And that cites some example. And actually, this neutrophil-leukocyte ratio, it has been studied beforehand. It is an important parameter. Can you explain, please?
After COVID-19, we have seen that those patients who has a high neutrophil as compared to lymphocyte ratio, the patient they are more severe. They are more severe. So NLR ratio has an important role after COVID-19. After COVID-19, there's a lot of study which emphasizing on NLR ratio, PLR ratio, and RDW. In fact.
Thank you.
Okay, thank you.